You are now going to be privy to a little behind the scenes podcast action whenever Melissa and I have like a 2-hour episode, at the end, we have to like pretend we're wrapping up and then like record like a new introduction to part 2. And then we like split it in half.
I was like, where are you going with
I know. So let's do that now. So
okay, so here's what we do, you guys. Okay, but if you were listening to this on the podcast, you would never know we did this. You would have
no idea. You'd be like, gosh, they ended it right at the perfect spot.
But you are getting a sneak peek into what's happening. Okay. And then sometimes he'll like have a snack. And then if he's not having a snack, he'll come back to the microphone and then he'll be like, wait, silence. We have to have silence. And then we stop right there. And then we'll kind of we'll edit somewhere, wherever we are.
Yeah.
So you guys, that's how it's done. Okay, now, for the record, we really don't edit much of the actual, as you probably know. They're like, obviously not, because it's not very fluid and it's awkward, and because we really just, go like we did now. But we do sometimes have to go back. Those are our little, that's the level of production on the vaccine conversation.
When you open the door for somebody else.
Welcome back to the vaccine conversation with Melissa and Dr. Bob.
I should say my own name from now. Welcome back. It's been a while. And
I know, we've been gone for like a few weeks, and now it's time for part 2.
Part 2. Oh, that's right. Coronavirus update. Yes, we've got to hit to the part 2. Part 1 was really interesting. If you missed that, go back and check it out. If not, we're going to just keep it going and talk about some more of these interesting articles and some scientific experts and what they have to say about what's going on.
Yeah. So what was the next thing you wanted to bring up, Melissa?
That's a good question, Dr. Bob. Well, so what's so interesting is this chief scientific advisor, when he had his conference where he talked about herd immunity, he got a ton of backlash.
Yeah.
A ton of backlash. The idea of herd immunity. Now, remember, the UK does not vaccinate for chickenpox as part of their childhood schedule. This is one of the ones they allow children to get and maintain herd immunity, which is why they probably don't have the same shingles issue that we have here in the United States. So anyway, he got a bunch of backlash, and then new advisors came forward saying, well, we are still going to push for voluntary closures and self-quarantining. But what I found so interesting was in the backlash, all of a sudden they said herd immunity is just a scientific theory. It's a concept. They said it's a concept. They said, so we can't use herd immunity as the reason we're going to go ahead and let this virus go through the population. It's just a scientific concept. You guys, a scientific concept that literally is the foundation for all of the mandatory vaccination laws, not just across every single state in our country, but across the world. Literally, herd immunity is the reason why they say they have to have a certain level of compliance. And he is saying 60%. What number do we hear? 95%. When I first saw this, I sent this to you because I thought it was really interesting that back when 1963, before the universal mass vaccination for measles, they were saying the herd immunity ratio, and they had discussed this in the 30s, 40s, and 50s, was 68%.
Yeah, they needed 68% of the population to be immune to measles,
the wild virus,
in order to create adequate herd immunity.
Right, so 68%.
Not 95%. They only
Nowhere
needed
close.
68%.
So they needed 68%, and then that number kept going up when they realized that vaccine-induced immunity did not create the same level of population protection.
Right. So this guy is saying if we could achieve 60% of herd immunity, but then look how unpopular that opinion was.
Well, and then it's just a concept. Herd immunity is not a real thing, guys. It's just a concept. Can you imagine them choosing when and where they get to use this? All of a sudden, herd immunity doesn't matter now, but it's the one thing Senator Pan used to pass laws that restricted people's rights and took away your right to have an exemption to vaccination. So it's just funny to me that once he got backlash, it was like, well, let's not go go too crazy on this herd immunity thing. It's just a concept. But anyway, a lot of people agree with what the UK was projecting here as it relates to the population's going to get it. They're going to get it. And you guys, the same is true for the United States. If you didn't get it this year, it's going to be next year. And I know you're saying you hope it's not the case. I think it will be. I think they're worried about these strains mutating already. They're saying from the time it started in December in China, it's already mutated. So the second thing I was going to say that why that matters, the first thing was that if it's a seasonal thing, then our hospitals are going to be overrun anyway. The second thing is if we cannot get permanent immunity to this, then a vaccine's not going to work. So for all the people that are sitting here holding on to the hope, let's just get the vaccine out in the next 12 months. If we're not gaining immunity to it naturally, the vaccine's not going to work either. And if we have a mutating strain every single year, you're going to need a different vaccine every year, just like the flu. Wow. And we know how well the flu vaccine quote works or doesn't work.
Right.
So it's not going to save us. So the only option for us, in my opinion, the only option is that our population gets it. It has to get it. There is no escaping this thing. So to shut down anything is not going to keep us from getting it. It's just prolonging the inevitable. And I understand trying to monitor certain things, but here would be my solution. Quarantine the elderly, like I said, allow the people who are healthy enough to get the virus, like children and younger adults and mid-range adults, to be out in the world. And our government should be helping people understand how to weather the storm better physically, how to prevent complications, how to stay healthy. And why don't you, as a doctor, why don't we stop really fast and give some recommendations for those who can't stay up and watch the rest of this of some things that they could do to kind of stay healthy? What's some advice that you have?
Well, like a few things I'm doing personally is I am eating better. I'm trying to say no to.
Well, what does that mean?
Well, like trying to get a hold of fresh fruits and vegetables. Don't eat junk food. It's what you do eat and what you don't eat. You want to eat the healthy, natural fresh fruits and vegetables as best you can. Healthy meats if you're not a vegetarian, healthy fish, or as organic as you can. Don't carb overload, just kind of follow your normal healthy dietary lifestyle that you're hopefully already following. But for me, it's also what I don't eat. I'm trying to say no to ice cream.
So sugar, say no to sugar.
Yeah, I'm totally. I mean, you've taught me that, these last few years.
It's the number one thing.
And I almost every night I say no. And then some nights I'm like, oh, I really need something.
Is that the night you get the coronavirus?
Yeah, I know, right?
The one night.
You reduce alcohol consumption.
Yeah, for sure.
It's getting exercise, go outside and get sunlight so you get natural vitamin D, but take a vitamin D supplement, take a fruit and vegetable supplement if you want as well, but go outside. But I'm definitely getting my exercise. I use an elliptical here in the house and I try to do that like 4 or 5 days a week. Cheryl and I go on walks, although we haven't lately, but we don't have kids to walk around with us, but but I know how that would feel if we, like you said, if we did have kids to go outside. But let's see. What else am I doing? How
about sleep? A good sleep routine.
Yeah,
getting sleep
I
is
haven't
important.
changed my sleep routine. I mean, I'm taking that that homemade yummy, not yummy, but kind of spicy herbal tonic thing that I think is really helping my immune system. I guess I'm taking it more seriously right now, though. All right. More seriously than ever, because it's so funny. I mean, I'll open the freezer to get ice cream and I'll be like your voice will be in my head. Do you really need that ice cream?
Dr. Bob. I'm like this little thing that pops up on your shoulder. Yeah. Do you really want to eat that right now?
That's so funny. But I mean, I'm taking this very seriously, and I think everyone can, and that's partly how we weather this is by making these smart decisions and then avoiding stress. Mm-hmm. And all the stress of this huge shutdown is really going to hurt people in a very big way.
Yep.
The stress of being economically affected,
physically and mentally.
Right, not seeing your friends, not seeing your colleagues, not having your routines, not going to work. I mean, that's going to hurt people big time. And again, that's why I implore the wise minds, that are making these decisions, that they will make the right decisions, for this, once this very hopefully short-term closure is done.
So tell me, have you heard Governor Newsom or President Trump one time in any conference talk about the things that you can do for your health measures to keep your immune system stronger so that when you get this virus, you get a milder case. Have you?
Well, I haven't watched most of them.
But in any of the ones you've
I don't
watched,
know.
in any of the ones
I
you've
haven't.
watched, no, I mean, they haven't been there. The government is not.
Which is amazing. They're spending so much time on the news. There's like hour and a half
I know.
press conferences every day, and I start watching them because they're kind of interesting to watch. But yeah, you're right. There isn't someone out there spending like 1 minute
Not
saying
even a minute.
what I just said.
They say
Right.
wash your hands.
Right.
They say stay home if you're sick. It's like, do we really need somebody to tell us this? This is like basic. If you're sick, stay at home. You should be doing that already. The fact that people need that information just tells you why people are so sickly all the time is because people are going out sick and exposing people all the time to other things that are not coronavirus.
I wanted to jump in real quick about the vaccine. You mentioned it. I'm kind of glad to see that they don't seem the main people don't seem to be like rushing the vaccine. I know they made a vaccine, they're testing it.
And they skipped animal
they
testing.
skipped animal testing, yeah. But I still hear people say we're like a year away from
Right.
having a usable vaccine.
Right.
Yeah, we should be, if we're really going to test it properly, we would be like 4 or 5 years away from using a vaccine. But it's not like they made a vaccine and they're just going to put it out next month. They're still saying,
Thankfully.
we're a year away, at the soonest from having a usable vaccine. So that means we're not going to be able to rely on a vaccine to shut this down.
Stop hitting the table.
Sorry. But no, I was thinking about this earlier today, and I almost was thinking that a coronavirus vaccine has so much potential to be problematic because if they rush it, they might get it wrong. It might not work very well because they've been trying to make a vaccine for the
Right.
cold virus and they can't get that to work.
And the SARS vaccine has a lot of problems in its first initial stages.
Yeah, the SARS vaccine that had like some problems where it would make the disease worse. So you could catch
Right.
like a worsened case of the disease if you had the SARS vaccine. And so if they get this wrong, and it's like the flu shot barely works. And so if they get this wrong and this vaccine, that's supposed to save humanity from this new scourge, if they get it wrong and it starts hurting people or doesn't even work, then they're screwed. I mean, vaccine confidence is already way down. And if they get this one wrong, then it's going to get even worse.
Right.
And I think they're rightly scared about that. So
especially because the measles vaccine works so well according to the vaccines that they have.
Right.
And that's the one they've been using for all the media panic and fear before, that if all of a
Right.
sudden now they've got the media panic and fear without a vaccine that works, because people don't have a lot of confidence in the flu shot.
Right.
So it'd be the same.
So I don't think they're going to rush it. And because they lose a lot of face, they lose big time if they rush it and they get it wrong. Or even if they don't rush it and they still get it wrong, they're really going to lose face. So I almost feel like they being the people that are trying to push vaccine mandates, I almost would see them wanting to solve this without the vaccine so they don't take that risk of getting it wrong. And then they can capitalize on the fear. Now they've instilled fear in the American public and the worldwide public that we have to fear children, we have to fear disease, we have to take these extreme social measures, and hopefully we can get a vaccine to solve it for us. But if we can't, we need to mandate everything else we can mandate and get everyone to fear their neighbor and turn on their neighbors if they're not complying with modern medicine. I worry that they're going to take that route, but I'm less worried that they're going to do something crazy with a vaccine, because I think that they can't afford to do that and make that wrong step. Again, I'm an optimist. I'm an eternal optimist, and but that's kind of my optimistic look at how they're looking at the vaccine so far.
Well, it's interesting, too, because the chief scientific advisor from the UK, again, he is not discussing the vaccine at all. There's nowhere in here that he's sitting there going, we need to wait for a vaccine and hope it comes along. He's like, we're going to get it. The country's going to get it. We can't escape it. So let's get it and get protection for our country so that we don't have an annual crisis every year. To me, that seems reasonable. The other point that he brings up, which I think is important, is when we're talking about these mortality rates, like I was saying, those numbers are calculated by taking the number of fatalities divided by the number of confirmed cases. The problem is, just like we saw with measles in the reported cases in the 60s before mass vaccination, the number of reported cases are those people who are sick enough to seek treatment.
Right.
That is not the same thing as the number of people in the general population that have it. So accurate mortality data is taking the number of fatalities divided by the total number of cases. That's a number we're never going to know. We are never going to know how many people had coronavirus because December, January, February, and currently right now, we have no idea who's already positive for it and has the have the antibodies for it in their body right now at this actual time. Because we'll never know those numbers, what they're doing is they're calculating mortality data based on those who are seeking medical treatment in a hospital. And that makes the numbers even higher. So that 2% that you're hearing, the average ratio, about 2% mortality rate for coronavirus, is not accurate. And so what this chief scientific advisor says is he says specifically, it's not clear what the actual death rate is for the virus in the UK. He said reports have suggested it may be much smaller than 1%. So this is before they even have the total general population getting tested. He's saying way below 1% is what the mortality rate, which is going to be more in line with what the flu is. And the reason that the flu is so small in mortality rate is because so many people get it. And we've got 30 to 50 million cases a year in the United States, according to Paul Offit, of influenza. So the amount of deaths divided by the total number of cases ends up being a 0.1% or 0.2% of mortality rate for influenza, according to the data. Right now, everybody's saying, oh no, coronavirus is 10 times more deadly because the rate is 2%. But that's out of cases that were seeking treatment in a hospital. Do you want to go on that?
Well, yeah, but we're finding with something like 90% of people that they're testing for coronavirus are negative.
Even more,
is that what
even
it is?
higher. Yeah.
Something like only 5 to 10% of people that are actually testing are showing positive. And they're only testing people who they suspect have been exposed.
Exactly, not the average Joe.
Right, who've been part of an outbreak or, exposed to someone who knows they have it, or they traveled from somewhere.
So with symptoms or connected to somebody with symptoms.
Right, and you have what, 5 to 10, I don't remember the exact number,
well,
but
originally
it's a very
it was
low number
2%
actually positive.
Originally, and then I think in the last briefing, they tried to say 90%, but data in other countries shows 95 to 98% were negative in all the other countries, including China, including South Korea.
Right, so that speaks to the fact that it is not spreading like wildfire everywhere as quickly because, again, most people involved in that spread that they suspect and they test, they're negative for the virus.
And so here's something people haven't thought about. What Sir Patrick says is if you clamp down too hard, if you suppress this too hard, that when you release it, it bounces back at the wrong time. So he said, from previous epidemics, this is what they've seen happen before, and this is why he's afraid of shutting down the entire country and then all of a sudden letting everybody reemerge. And I agree that there's something to that. So he said your goal is to, what they say, broaden that peak a little bit, and that is so that he's saying people need to get herd immunity in the parts of the population that will end up protecting long term. He said the vast majority of people need to get it. It's a mild illness. He said it can bring herd immunity to the people that we need to protect, the most vulnerable, and it can reduce the transmission if we all get it. This is what he's saying, and this is why it's so important. So he said some of the measures for social distancing that were in place were quite extreme, in quote, quite extreme. He said it's eye-catching. People think it's a big deal to cancel all these big gatherings, he said, but actually it's not really affecting the ability to stop the transmission because he said you're much more likely to get it in smaller circumstances, not bigger ones. So he said it's trendy to be one of these governments that really takes this hard action, but he's saying it's not actually having a big effect on transmission. And so he said they need to work on doing the most important things first, which are self-quarantining the older people that are vulnerable and doing things like staying away from the public when you're sick and hand washing, like they said. But this guy got so much backlash for presenting this approach to the country, which they've gotten a little stricter, but not too much. They haven't done what we've done here, and they're not seeing skyrocketing numbers. And again, they don't vaccinate for chickenpox, which we have 2 doses that are required by law in our state now to attend school. You have to have both doses of the chickenpox vaccine. And some people that have had the wild infection are even having a hard time getting a medical exemption to prove immunity to that and are forced to get the vaccine anyway. And this is a country who has opted out of that for entire generations of children. And you don't hear about these crazy numbers, do you, of death from varicella in the UK?
I mean, I find it very encouraging as a pediatrician, because my heart is really, for kids' health or everyone's health, but I love the kids especially. And I loved this brand new report from CNN. And we're probably going to go through all this later, but I mean, looking at the kids, the data, they basically reported on what we know so far from China, all right, and the data that we have, and this study was published in the journal Pediatrics just on Monday.
And is that junk science, or is that accurate information?
That is not.
So nobody can say
not misinformation. This comes from Pediatrics. They looked at 730 confirmed cases of COVID-19 in children in China, and then another 1,400 suspected cases. They said out of all those cases in China that they looked at, more than 90% in kids were either asymptomatic or showed mild or common forms of the illness. So over 90% had really, really mild symptoms or barely showed symptoms at all.
And people are concerned about their kids right now. This is why he's telling you this.
Right.
You have young children. You're worried about this. Yeah. People are panicking. You're thinking, I have a baby. I have children. Is this something I should be worried about? This is what data is showing.
Right. Out of China. About 13% of the patients who tested positive for the virus did not show symptoms of illness. All right. 13% didn't even show symptoms, they're saying. Out of the combined, 700 confirmed cases and 1,400 suspected cases, one child, a 14-year-old boy, died. All right.
And we don't know about underlying health conditions of that.
But one child out of the over 2,000 cases in China they looked at. So to me, that speaks to the fact that as parents, we don't have to fear for the lives of our children.
But there have been 80,000 cases in China and still no more deaths.
Wow.
So, I mean, that's still, I mean, you don't ever see numbers like that for any illness.
80,000 in
China.
Right.
And still only the one death for the 14-year-old boy.
Okay, so no more pediatric. That's why that's amazing. And again, they said 6% of all the kids they studied, 6% had severe cases, had to be hospitalized and everything. But again, only one child died. And to me, that's encouraging. And again, it's so funny that it makes no sense that our first step was to close the schools. That was like the first thing we did. And what we do, like you said, we sent all those kids home to live with their parents
and grandparents,
or to be cared for by their grandparents. Right. All these kids are coming home from college.
Plus the different cultural norms. A lot of places we have multi-generational households in our country and in lots of other countries. So that's basically putting people in direct contact.
Yeah. So I just wanted to throw out those pediatric numbers really quick because, again, that's near and dear to my heart. But I hopefully believe that's.
We can do that one. Do you want
hopefully that's encouraging to you guys. But yeah, we can, because it talks about the adult data that they've heard, and this again,
Go ahead.
The study, you can use mine too.
That's right,
but the study is that data from China shows majority of people with COVID-19 only suffer mild symptoms, then recover. And this was from yesterday by Ivana Kotasova.
And I posted
CNN.
about this on my page.
Right.
Yeah. And this is CNN. So I'm noticing a lot of the terminology like social distancing and social responsibility and children are vectors and all these things. I'm noticing that from the very ultra liberal side. That's what I'm seeing personally. And so I just want to verify this is a CNN article. Okay. This is not like something this is still something from the, quote, liberal media that is talking about still only mild symptoms and people are recovering. And I mean, part of me does feel a little surprised that we're seeing articles like this that are this open. Considering our nation has taken such strong, right?
They reported the pandemic began in China, but China just reported no new local infections.
Right.
That means the measures they took, whether it's the measures they took or it just died out or whatever, or just naturally ran its course, no new local infections. So that encourages us that this should, decrease soon and come to an
Right.
end fairly reasonably soon.
And so
right?
what I keep hearing from people is that this is just going to exponentially grow in the
It's
United
not,
States.
right.
And it's like this linear. So imagine a linear curve. It just keeps getting worse and worse and worse. You will see a linear growth of the number of cases in the United States as they're testing now, but that is not the growth of the virus and the spreading of the virus. So what they have said is with all viruses, it is on a bell curve. Okay, do you guys remember from high school? It's like this. There's a peak and that peak comes down. There is no such thing as a virus that moves in a linear fashion that will just keep going, keep going, keep going. That's not how viruses work. So China is the place it started. If there are no new cases, it is on the downtrend of that virus. It's not going to just keep going up again, up again, up again. And the United States is not going to do something different than every other virus has done. So
Right.
we're using China to show you what's coming for the United States, because obviously that's what's going to come next. Is there's going to be at some point the curve is going to start coming down, and that's what a virus does anyway before taking efforts that are very drastic, or some would say draconian. So it's very encouraging to know that there are no new cases in China, because that is
Right.
a guideline for where the rest of the world is going to be going.
So they showed it affected men and women equally, but there are about twice as many deaths in men as there were in women.
And I wonder if that's because of smokers. Men tend to smoke more than women, and in Asian countries, there are high levels of smokers, and Italy was another example. And so those are two places that have been very affected by male elderly dying in both of those places.
Right. And then only 20% of those who are diagnosed with the virus experience severe or critical illness. So it's mild in 80% of people in China. It was severe in about 14%, and then it was critical in almost 5% of cases.
So what breakdown is that usually for the flu, would you say? Like, to me,
I really don't know.
I don't feel like 80% of flu cases are mild. I feel like probably less than that. I think probably there's like maybe half.
I don't know how they define severe. Severe
Right.
probably means like you're hospitalized. Critical probably means you were like in the ICU on a ventilator and you almost died. Maybe. I don't know how they define. So this seems...
Severe to me would be like you're seeking care. If you're mild, you can go home and
Because I don't know
convalesce.
how they define this, unfortunately. But they said 80,000 confirmed cases in mainland China. About 70,000 have been, has run its course. They've been discharged from the hospital. About 3,200 have died. All right. This is the report published just on Thursday.
And again,
Right.
that's 80,000 that are cases of people that sought treatment to be confirmed or
Right.
tested or connected to cases.
Right. And about 3,200 died. So I sort of got the impression there's a lot more than that.
I feel like there have with a population of 1.4 billion in China, I feel like there have been at least a million cases.
So,
of just cases.
Right. Yeah. So we might get more about, fatalities.
No, the fatality rate hasn't gone up that much from
Right.
this.
Okay.
I think it may be maybe 3,500 by now.
Yeah. They say most people recovered. So again, this is kind of the same. But they say 87% of people who had it, they say the worst is over. 87% of people who had it have now recovered. There's about 9% are still like active or maybe hospitalized, still feeling sick. They say about 4% of the known cases were fatal. Although other numbers showed it was about maybe 2%. Right.
Okay, so speaking of fatality numbers as it relates to this particular study, and I'm going to talk about this point.
Yeah.
So one thing I found interesting is from the age bracket from 0 to 49, the fatality rate was actually 0.2%.
Which is his 1 in 1,000? 1 in 2,000 people.
Okay.
Do you know?
I know. I mean,
I'm trying to do the math really quick in my head.
My calculator's there, so I can't do it. So what I'm saying is, when you hear that China's fatality rate is 2%, that does not mean 2% of the population.
2 in 1,000, so 1 in 500.
Yeah, 1 in 500.
Right. Yeah, there you go.
Because 0.1 is 1 in 1,000.
Yes.
0.1
Right.
would be. Okay, anyway. 0.2%. And again, these are just of the cases that sought treatment, not of the general population. That number would be way
Right.
smaller if we actually included all the cases. But it's not even 2% of China. That's the average from anybody 50 years and under, which we're talking about the majority of your workforce and your entire school, all the school children.
Right.
It's 0.2%. That means 99.8% of that group is not dying from coronavirus.
Right.
And that's just, again, I have to say this again and again and again and again. The total cases is not an accurate number. So what I'm giving you at 0.2% is still way higher than it actually is, based on the entire population and your chances of getting it, your chances of having a severe complication for it. You cannot use a blanket statement that 2% of people die from coronavirus. That is not accurate. Right. Between the ages of 0 and 50, 0.2% of people who sought medical treatment or were connected to it in a known case died from it in China. That is not the same thing as what are your chances of dying for and what's going to happen here in the United States. Right. You have to know the difference there.
Right. And compared to they say about 15% of those who are 80 and older died of known cases died. And
which
again,
is the same for the flu. When you're looking at age brackets, that ratio gets as high. This is a respiratory virus.
Yeah, so that kind of speaks to, I guess, your point, saying if we had more targeted interventions, targeted efforts, where maybe people who are older, maybe they voluntarily stay home from work, but younger people do return to work more quickly and get life returned back to normal, get the economy going again. I mean, all these studies, they've absolutely confirmed that the elderly are the ones that are at the most risk. They're the ones we need to help protect. They need, maybe we don't have to shut down the entire country. You don't have to have everyone stay home from work for 6 months, or have all the kids stay out of school and close all the universities and turn everything online. Because again, what that would do to our economy, everyone's saying, could end up doing way more harm than this virus would ever do to people. And that's why now that we're learning these data, hopefully people will start making smarter choices about what we're going to do with this virus and for how long we're going to do it.
So let's talk about Italy. Can we move on from that?
Yeah. Well, lastly, they just say people with other health issues were also a major risk factor.
Of course.
Right. And the fatality rate, people who died almost always had some other, not only being elderly, but other underlying health conditions. And they say what? 1% of people that died had no underlying condition.
1%. That means 99% did have some type of underlying condition.
Right.
So, and the same is true of what they're talking about in Italy. So in Italy, which has been the hardest hit nation out of any country in the world as far as the fatality rates go. Again, when I looked into the data on Italy, I was shocked to find 300,000 elderly die every single year, and that includes respiratory viruses. Okay, so the elderly are 25% of the population. That's way higher than what we have, and so because this virus is targeting elderly and elderly with underlying health conditions, they're going to experience this more. So a recent study from Italy that looked at the death certificates and medical history of those who were affected showed, and this is, quote, 99% of those who died. This is in Italy, you guys, which is the hardest hit country, and the highest level of fatalities that we have is Italy. 99% of those who died from the virus had other illnesses, right? Again, like you were saying from the China data, only 1% did not have an underlying illness. So this particular study from their National Health Authority looked at more than 2,500 cases that they had. And what they found was about 50%. So half of the cases had 3 or more illnesses. Wow. 3 or more underlying conditions. Right? Like they had cardiovascular disease, they had lung disease, and high blood pressure, or they had diabetes, high blood pressure, and heart disease. There were 3 underlying medical conditions for 50% of those who died. Not 50% of cases, 50% of the cases where there were deaths. Again, you've got a high number of cases, only a small percentage of that leads to fatality. Out of the fatalities, half of those fatalities had 3 or more underlying health conditions. This is one of the reasons we're seeing Italy have higher levels of fatalities. 25% had 2 other conditions, and another 25% had at least 1 other condition. So only 0.8% had no underlying illness. Okay, so more than 75% had high blood pressure, which I just, that's a stress situation as well. And it has to do with lifestyle. Like I said, smoking, things like that play a role. I just think about what's happening right now with the way that they dealt with this and the kinds of stressors they're putting on people, and people that do have maybe mild health conditions now that are going to be exacerbated by the stress and the circumstances of what's going on, which is just crazy. But they also found out that the median age was 80.5. Okay, so this is a very much older population of who are dying from this. And from under 40, there were 5 cases of deaths under 40, and those were all in men with severe medical conditions. Under 50, there were a total of 12 deaths that they saw. The majority of the deaths were obviously in the 80 to 89 category and the 90 plus. So this is in Italy where they were hardest hit. And it was interesting. They're saying that even in Italy, so right now, I think it shows their fatality rate at like 7 or 8% when you calculate it. But what they're saying is they think at least 100,000 Italians have contracted the virus and it just haven't been tested. And so that would bring the country's death rate closer to the global average of about 2%. So even the country that people think is the highest level is actually closer to the global average of about 2%. And again, that 2% is not equally distributed across all age ranges. That is a higher level for over 80. And again, 0.2, probably 0.1% for anybody under 40 or under 50 years old. So again, you cannot use 2% and just apply that to your country's population and try to tell everybody millions are going to be dying if we don't do this. That's not how you use numbers, and numbers have different weight for a reason.
Yeah.
Oh, I heard that. I thought that was your dinner call, like a whoo-hoo, like a secret call of like dinner's ready. Let's talk about Paul Offit. Because
I thought I'd never hear you say those words.
I know. Okay, can I just tell you? Can I just tell you that somebody shared a status update by Paul Offit, and I clicked on it and I saw his cover page, which advertises a book, and it's called Overkill. How the medical industry is basically medical interventions are too much when it's too much. And I literally told these people, it's a fake account. It's not real. That cannot be Paul Offit's page. There's no way he's writing a book about when medical interventions are too much. And there's no way he's writing this post. So I realized something's got to be wrong. Turns out it really was his page. He really does have a book coming out that was scheduled for release next month called Overkill. And I want to read you the description of this book.
With us today in studio is
Paul Offit.
No. Can you imagine?
Oh, God, no. But I want to read you the description of this book. So anybody who does not follow the vaccine debate and doesn't understand who Paul Offit is, he is a very big proponent for vaccines, for increasing the vaccine schedule. He's had a patent for one of the vaccines, the rotavirus vaccine. And he's been very outspoken for needing vaccine mandates and just always being a proponent against, quote, anti-vaxxers, et cetera. So his new book, okay, it says... he's an acclaimed medical expert and patient advocate, and he offers an eye-opening look at many common and widely used medical interventions that have been shown to be far more harmful than helpful. Yet surprisingly, despite clear evidence to the contrary, most doctors continue to recommend them. Okay, this is the intro to his book. So here's the description of the book on Amazon. Modern medicine has significantly advanced in the last few decades as more informed practices, thorough research, and incredible breakthroughs have made it possible to successfully treat and even eradicate many serious ailments. Illnesses that were once a death sentence, such as HIV and certain forms of cancer, can now be managed, allowing people to live longer, blah, 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 blah. We are still relying on medical interventions that are out of date and can adversely affect our health. This is what Dr. Paul Offit is saying. Was he a doctor of?
He's infectious disease.
Okay. So he's saying that we still are relying on medical interventions that are out of date and can adversely affect our health. He uses the examples of antibiotics and fever-reducing medicines and sunscreens. Okay, so he says, in this book, he debunks 15 common medical interventions that have long been considered gospel, despite mounting evidence of their adverse effects. What does that sound like, Dr. Bob? And then he says, but still the medical culture continues to promote them. So this book, Overkill, informs patients to help them advocate for their health, you guys. Look at Paul Offit. He is just encouraging people to advocate for their own health and the health of their children. This seems like the right time to do that, right? And so anyway, he really does have a book about interventions being over the top and doing too much. That really is his page, if you also saw this post. And so he wrote a post. Do you want to read half of it? So I'll read the other. Can you read it from, you want to read it from here? Can you read it that far?
Yeah.
Oh, you have good eyes.
Yes, I do.
Okay, so read it up to that part.
You just stop me. Okay.
This is a real post.
This is his
date?
post. Okay.
What's the date on this post so people can check? Okay.
I don't know.
All right.
Why are we so scared of COVID-19? People are usually scared of viruses for 3 reasons. 1, the virus causes gruesome, disfiguring symptoms like smallpox. 2, the virus has a predilection for children, like polio that paralyzed tens of thousands of young kids. 3, the virus is likely to kill you, like rabies kills virtually 100% of people who develop symptoms after a bite. The novel coronavirus circulating in the U.S., the one that has caused us to shut down schools, restaurants, and everywhere else, falls into none of these 3 categories. Nonetheless, people are really scared. The reason is they think if they catch COVID-19, they have a high likelihood of dying from the disease. Most public health officials have done little to lessen this fear.
That's an important line.
Arguing that people are 10 times more likely to die from this novel coronavirus than from influenza. Unfortunately, these officials have not made clear the difference between relative risk and absolute risk. Although people are more likely to die from COVID-19 than from influenza, if they catch it, he means, they are far more likely to catch influenza. Therefore, they are far more likely to die from influenza.
And people are not panicking about influenza, and they're not shutting down anything, and they're not scared that anytime somebody coughs, they're going to die. According
to the CDC, as of March 7th, 36 to 50 million people have suffered from influenza. About 500,000 have been hospitalized, about maybe 30,000 have died. To put these numbers in perspective, let's look at COVID-19. In China, they've reported roughly 3,000 deaths. There's 1.4 billion people there. If we suffer an equivalent proportion of deaths in the U.S., then 1,000 Americans will die from COVID-19. 1/20th to 1/50th the number of people who have died from influenza. So far, we've had just over 200 die in the U.S. Italy has reported 2,000 deaths, and as a result, has shut down the country. Italy has a population of 60 million, about 1/5 of the U.S. If we suffer the equivalent to Italy, then 10,000 Americans will die of COVID-19, which is about a half or even a fifth of the number of deaths from influenza. Not everyone, however, is at equal risk of dying. The virus primarily kills the elderly and those with chronic diseases, which explains what's going on in Italy, like we just told you the numbers. Wouldn't it make more sense then to ask people who are elderly and infirm to stay away from crowds, thus lessening their chance of contracting the disease? Also, to ask people who are sick with respiratory symptoms to stay home. Focus on common sense things like washing hands several times a day and standing clear of people who are coughing or sneezing. The federal government can also help by making it easier for businesses to allow people who are ill to stay home.
And that's one thing that people have talked about is the idea that the government should be intervening and allowing employers to give more time to employees to stay at home when they're sick and when their children are sick, to make it more likely that people convalesce at home and are not passing and transmitting viruses out and about in the world. Because some people feel like, hey, I don't have a choice. I'll lose my job if I don't go back to work. So I have to send my child to school a little bit sick, or I have to go to work a little bit sick. So even Paul Offit's talking about making it easier for businesses to allow people to take time to heal and allow people to take time to be symptom free before they're coming back and being exposed to other people, creating more transmission.
So in 2009 and 10, the world suffered the swine flu pandemic. Over 200,000 people were killed by the virus, 12,000 in the United States. This coronavirus has killed about 6,000 people to date, in contrast. And
at the time of this post,
it doesn't make sense to shut down our entire way of life to try and stop a virus that is unlikely to harm healthy people and will be far less devastating than the influenza epidemics that we experience every winter and the swine flu pandemic from 10 years ago. Let's take common sense measures to stop the spread. The precautionary principle dictates caution to prevent harm. But this principle also dictates that you don't cause harm in the name of preventing harm. Boy, we could talk about something else relating to that.
Right.
It will take years to recover from the draconian measures that we are currently instituting.
Yeah. And so some of my favorite parts of this, again, it's so weird to agree with Paul Offit on anything. In fact, he had a second post yesterday that was interesting. The name of this post that he kind of titled it was, "Which will do more harm, the virus or the fear of the virus?" And it's so odd to have somebody like him basically trying to calm people down when it feels like he's usually trying to amp people up to be a little bit scared, which is why we need medical interventions. But here he's saying the 3 reasons people usually get fearful of a virus are the fact that it's going to cause some really debilitating effect, it's going to go after children, and it's likely to kill you. And none of those 3 things are true of coronavirus, but everybody is panicking. And he said they're shutting down schools, restaurants, sporting events, and every aspect of our culture when the coronavirus doesn't even fall into any of these categories. He said most everybody assumes if they catch it, they're going to die. And I have to blame the media for this. The media is responsible for, like you said, patients calling you up, my kid's coughing, do they have corona? Are they going to be dying? And overloading and overburdening the hospitals by showing up there, panicking. What does panicking do to your breath? Shortness of breath. I'm panicked. I'm afraid I have something. I need a ventilator, a respirator. Like, it's taking things that would have usually been an illness you could handle at home, and it has now turned people into this exacerbated sense of illness where they feel they need intervention, they need it now, and they need resources and supplies, and it is overburdening us. But like Paul Offit says, public officials have done little to lessen this fear. He's blaming public health officials for not doing enough to lessen the fear for the public. And that is a problem. We are counting on our officials and our regulatory agencies to give us up-to-date information, to be transparent, and to be honest, and to provide us with tools to, like I say, weather the storm. Give us some information on how we can do things to support our immune system right now so that if we're going to catch it, which we are at some point, let's make it a mild case so we don't have to go to the hospital and worry about that aspect, which is the reason they're shutting everything down, right? He talks about that relative risk and absolute risk. That's important. It's not just a risk to everybody. There are certain risks, right. and that makes a difference. Can't we the same? I feel like this is just like us going to the California legislature saying, isn't there a better way to worry about the spread of vaccine preventable disease than taking away exemptions for everybody? Yeah. Can't we fine tune this? Remember Nazarian? Can't we fine tune this bill to really deal with people who are taking advantage of the system and not blanketly take away rights of all these people? It's the same thing. Our government is taking these drastic, generalized steps to protect a subset of people that maybe could be protected a different way. And can I remind you, that subset of people is at risk every single year from every single respiratory virus, and nobody was shutting anything down then. So, this is the kind of stuff that kind of gets to me. But if you're interested in reading Paul Offit's post, Go check his page. It was interesting. I think a lot of people in our movement were surprised to agree with him and, oh my gosh, even like his post, which probably I couldn't do it. I honestly couldn't do it. I agree with the post. But when I was like anybody else, I would have been like, love, like, share. I couldn't do it, you guys. I agreed with it. I thought he made a lot of sense. But like there were twitching muscles in my body that kept me from clicking that mouse to like it. I could not do it. I'm so sorry. But anyway, so
should we wrap?
no, we're gonna keep
It's
going.
9:30.
Okay. Oh my God, is it really?
It's 9:35.
Okay, so let me just really quickly summarize a few other articles that you can find more information on my page if you're interested.
Oh, so we don't have to do this again in a couple nights from now.
Yes, we do, because that's a different article altogether.
Okay.
So let me just briefly tell you, I'm so sorry it went so long. This is a complicated topic. So the one thing I thought that was really interesting is there was a guy from Israel who was talking about the slowing of the epidemic in China. And he was saying this is not going to pose a threat to people. Now, this guy, you guys, is Israeli. He has won the Nobel Prize. Okay. So this guy is super intelligent for chemistry. He's a biophysicist. He creates multi-scale models for the complex chemical systems. And he was talking about the forecast about this virus and how it was going to slow down and how basically we don't need to freak out. And I posted about him the other day.
Yeah.
So the name of this title is Israeli Nobel Laureate, how do you say that?
Yeah.
Coronavirus spread is slowing. And it's so weird. It's like if you post something that talks about how this is maybe not that big of a deal, there's always somebody that wants to slam you and is almost angry that you're not being more dramatic about it. It's like, wouldn't this be nice if this was true? Again, these are not just my own thoughts. We're talking about people all over the world that are experts and specialists, and they're sitting here saying the same thing. And you get completely attacked if you're not caught up in the drama. If you minimize what's going on, people look at you like you're un-American and like you want people to die. It's so ridiculous. We should want people to tell us that there is minimization. I'm making up words, that we should be minimizing what's going on. We should be bringing down the drama and the panic in this. We should be looking at actual numbers. And we have a few more really great articles to bring you in a couple days, because I guess we're out of time, because I'm getting like the elbow nudge. You know why? Because he wants to eat. That's why.
Dinner's at 9:30.
Yeah, I know. Oh, so let me just tell you, in this last article, one of the things he brings up is the Diamond Princess cruise line and how that was a contained environment, and still only 20% caught it, not died from it, caught it. And I think there were 7 deaths out of the 700 people on board, and they were all elderly. And it didn't talk about their health conditions, but they said a cruise ship tends to attract more of an elderly population, so that's not even realistic what would happen in the general population. So he was saying 100% of the population is never going to get this thing, because even in contained environments, it's not spreading that fast. So he was just trying to give a little bit of realism to what's going on here. And this was from the Jerusalem Post. So super interesting. Again, I posted about it in the last week. We'll get to a few of these other, 4 other articles that we didn't go. We'll get to a few of these.
The gist of it is, have you actually found an article written by like a medical professional where it says coronavirus is going to kill us all, we all have to panic and be super scared? Are people also writing those? And
I don't know. I've seen some that say why we're not doing enough and why we're not overreacting to this. And
are those medical professionals writing that?
I don't know, because as soon as I see that headline, I'm just like, there's no reason.
I mean, the media, like Gavin Newsom's media is asking him questions like that, but
I don't know.
Those aren't medical professionals. So
I don't know.
I wonder, but
okay.
Anyway.
So we have a ton more to bring you.
Yeah.
We will do that against Dr. Bob's wishes in the next couple days, because everything changes so quickly. So I'm sorry if you thought this was interesting at the beginning and then lost us somewhere at the end. Hopefully you guys are.
72% of people have stayed with us through this entire broadcast.
But is that 72% of the entire population of our followers, or only who was checking in with us?
And is it how many are like younger people versus the elderly or children? I don't know. Who knows?
Do we have any elderly followers out there?
Well, thanks for hanging out with us, you guys. But I'll have to edit this one quickly while it's timely.
Edit it. We can't edit it because
No,
now
I mean
it's out
like get it
there.
out there quickly.
Oh,
like
okay.
when I
So-
send it to you for like review, don't take like 5 days.
I'm gonna
like,
take
get to
5 days while I'm looking up all the new articles for the next thing because that's what's gonna happen. Okay, so see, cool podcast T-shirts, yay! If you missed it at the beginning for our tour, whoa, look at that! Can you see it? Woo! You see that country? There's a country there with stars. All the states we're gonna be checking out one day when life gets back to normal, guys. Fingers crossed.
Right.
Anyway,
well,
so
you've
here's
said-
our Facebook Live and Instagram
Okay,
end.
so you've said goodbye to the podcast
Right,
people
right,
already,
right.
so they can't even hear what we're saying. So we could like say stuff about
Ooh,
our podcast.
give them a
listeners.
stat or a fact that like nobody else gets to know that only these people that they hung to the end. You guys hung to the
Yeah,
end.
I'm hungry, so I'm out of facts. Are you out of facts?
I am never out of facts, but I will not give you guys any facts right now because I'm so happy that you stayed this long. So sorry it took so long. But
I guess-
thank you for joining us on a Saturday night when you had nothing else to do. And I appreciate you guys being here. And he's like messaging people, we'll be in for dinner in 3 minutes.
No. I'm telling Jocelyn to come over and bring you your tonic.
Got it.
So,
Okay, so thank you guys. I will go back and look at the comments and write back to you guys on Facebook Live. Can you do that on Instagram? I don't know if you can. I haven't used that video. Anyway, thank you and thank you. Did you think both?
yes, thank you guys.
We're gonna be the peace we wanna see in the world. Yeah, be the peace we wanna see in the world. Yeah, be the love we wanna see in the world. Be the joy we wanna see in the world. Be the change we wanna see in the world.
The information in this podcast is for entertainment purposes only. It is not intended as medical advice. Always consult your healthcare professional for information on vaccines and infectious diseases.